Okay, guys, today we are going to see about what is systolic heart failure, what is diastolic heart failure. It's so complicated, I think. So, I make you understand very easy with this complicated thing and with this super equation. I find it in some book that is systolic heart failure, diastolic heart failure, and this compliance thing. Before going to this thing, I have to ask two things: whether end diastolic pressure is equal to end diastolic volume, and the decreased cardiac output is equal to decreased ejection fraction. Do you guys think end diastolic pressure is equal to end diastolic volume, or decreased cardiac output is equal to decreased ejection fraction? Okay. Many people have been familiar with cardiology, you may be able to understand this thing, but I will start from the basic. Actually, nothing but there is systolic heart failure, and there is new term called systolic heart failure with reduced ejection fraction, and there is diastolic heart failure. And before that, if you guys know about end diastolic volume pressure is equal to end diastolic volume, it is true or not, you put it in the comment box. Okay, systolic heart failure is equal to reduced ejection fraction heart failure, and diastolic heart failure is equal to heart failure with the preserved ejection fraction. Okay, in both systolic and diastolic heart failure, there will be decreased cardiac output. Decreased cardiac output means amount of blood ejected by the ventricle will be less only in both systolic and diastolic heart failure. But this ejection fraction thing is different. Ejection fraction thing is here decreased, here normal. This itself implies that ejection fraction is not equal to cardiac output, is completely different thing. Okay, fine. There is some first of all we are going to see about systolic heart failure. So in systolic heart failure there is something before that we are going to see about preload. Preload is equal to end diastolic volume. What is this preload? Preload means the amount of at the end of diastole, like at the end of diastole there is some blood present in the ventricles, either right or left ventricle. That ventricle is the preload. Like we can say like the blood present in the ventricle before the heart contracts, it's called preload. If the preload increased, the cardiac output is increased in normal people. But yeah, in systolic heart failure patient, like MI patient comes with a systolic heart failure, that persons cannot able to pump the blood. So the increased cannot able to pump the blood, it leads to keep on accumulating blood at the end of diastole. So we can say like increased end diastolic volume or increased preload keeps on occurring. And this, if there is increased end diastolic volume and increased preload, it directly tells there will be pressure is increased. It's very easy to understand. Pressure is increased when there is increased end diastolic volume, when there is increased preload, there will be increased end diastolic pressure. It's like you can understand this thing with like one balloon. If there is balloon, if you keep putting water, first sometime it will start to expand, but after some time it cannot able to expand, so the volume keeps on increasing and the pressure keeps on increasing. Okay, fine. So in systolic heart failure, the end diastolic volume is equal to end diastolic pressure. End diastolic volume is equal to end diastolic pressure. Okay, fine. So here cardiac output is decreased. With the ejection fraction formula is completely different from cardiac output. So we are going to see about ejection fraction is equal to systolic volume divided by end diastolic volume. You know the ejection fraction stroke volume is decreased in systolic heart failure. That is indirectly means cardiac output is decreased, and end diastolic volume it's increasing because the decreased cardiac output causes the volume keeps on increasing, so it leads to decreased ejection fraction. So this systolic heart failure is very easy to understand. Now we are going to see this equation. The systolic heart failure, okay, fine. High end diastolic pressure, correct. High end diastolic volume, correct. Low ejection fraction, correct. Decreased cardiac output, correct. Okay, fine. Now we are going to see about diastolic heart failure. One complicated this term is I in the first time I read, it's very difficult to understand. What is this? Diastolic heart failure is all about I think like it's a diastole, some impairment, but actually it's a decreased ventricular compliance. In the book it's written as decreased ventricular compliance. What is this compliance? I think only compliance in terms of the people who have decreased compliance means the people is not taking drug. That means if there is a ventricle is not obeying, that like I am thinking, but actually decreased ventricular compliance means decreased ventricular distensibility. That means the ventricle can't able to expand. It's such a easy thing. The ventricle can't able to expand. That means if there is one balloon and the balloon is fibrotic, okay, if the balloon is fibrotic, so if you pour water for small volume of water, there will be pressure increase. You can able to understand, because that balloon can't able to expand. So if pour small volume also, the pressure will be very much increased. So there is one formula here written. Compliance is equal to change in end diastolic volume is equal to change in end diastolic pressure. Here there will be decreased end compliance. So decreased compliance means increased end diastolic pressure and decreased end diastolic volume. That balloon thing you are going to understand here. In ventricle, in left ventricle or right ventricle, there will be decreased amount of volume only, but there will be increased pressure. Okay, so it leads to increased end diastolic pressure. Okay, fine. If the person comes with increased end diastolic pressure, we can say it is equal to diastolic heart failure. Is not. The initially increased end diastolic pressure, but stroke volume will be maintained. But after some time, there will be decreased venous return, and there will be decreased end diastolic volume, and there will be decreased cardiac output. Okay, so we are going to say in diastolic heart failure when only the increased end diastolic pressure leads to decreased cardiac output is equal to diastolic heart failure. If the end diastolic pressure leads to normal cardiac output is not diastolic heart failure. Only when end diastolic pressure leads to decreased cardiac output is diastolic heart failure. So you are going to see, like here you are understanding that increased end diastolic pressure is inversely proportional to in diastolic volume, and here also there will be decreased cardiac output. That's only when there is decreased cardiac output, only because we are saying heart failure. Okay, fine. Here ejection fraction, what happens, man? If you are thinking like ejection fraction is equal to stroke volume divided by end diastolic volume. Here stroke volume is decreased because decreased cardiac output. End diastolic volume also decreased, but end diastolic pressure is increased. Okay, fine. So decreased normal. It's such a comedy mathematics. If both things are decreased, it's a normal in mathematics, not in life actually. Okay, fine. If there is increased end diastolic pressure leads to decreased end diastolic volume, here in diastolic heart failure, okay, small volume, increased end diastolic pressure, decreased end diastolic volume, decreased cardiac output, but ejection fraction is normal. Okay, fine. Now we are going to see this equation. Diastolic heart failure is equal to high end diastolic pressure, low end diastolic volume, normal ejection fraction, and decreased cardiac output here also. And you are in diastolic heart failure compliance formula. You understand this. Okay, end diastolic pressure is initially I asked you two questions. End diastolic pressure is equal to end diastolic volume. No. End diastolic pressure increased, and both end diastolic pressure and end diastolic volume is increased in systolic heart failure. But end diastolic pressure and end diastolic volume is inversely proportional in diastolic heart failure. So if you see, if there is increased end diastolic pressure, don't simply think it's a increased end diastolic volume. Okay, the cardiac output, ejection fraction are equal? No, completely different. In both systolic and diastolic heart failure, there is decreased cardiac output, but because of the formula, ejection fraction is nothing but stroke volume by end diastolic volume. In systolic heart failure, it's decreased, but diastolic heart failure is because of the comedy mathematics, both are decreased. It's normal in diastolic heart failure. Okay, fine. What is we are going to see in clinically? Okay, how will you measure this end? We are cannot able to measure end diastolic volume. We can be able to measure end diastolic pressure. How? In end diastolic pressure can be measured on right ventricle using central venous pressure, on left side using pulmonary wedge capillary pressure is equal to